Good morning, evening, and afternoon, depending on when you are listening to this video or watching this video. Dr. Dale L. Gooden, adjunct professor here at North Central University, and I have the privilege and pleasure of being your facilitator for MHA 5006, Health Information Management. It is a 3-unit course at the master's level. Little bit about me. I am actually new to North Central University, but certainly happy to be part of such a professional staff and a rigorous university. I do have a Doctor of Health Science with the concentration in education from A.T. Stiles University of Osteopathic Medicine. That is the founding institution of osteopathic medicine, as well as the founding institution of whole person healthcare. I have a Master of Business Administration with the concentration in Health Services Management from the University of Laverne, and I'm an adjunct or either an associate professor at several universities, including Ohio University as well. And I am a doctoral faculty advisor at Franklin University, and that's located in Columbus, Ohio, as well as being the lead adjunct faculty for Concordia University, Irvine. In addition to that, I teach at Laterno University as well, and that's out of East Texas. So let's talk a little bit about MHA 5006. In this course, you're going to learn about the role of health information management and all of the technologies that are associated with that. You're going to be in a position to analyze the implementation of these types of technology, whether they be on the software side, the hardware side, or perhaps even the programmatic side. And we will look at billing systems, clinical systems, hybrid systems, and other types of systems that I'm sure you use every day in your health systems. The learning outcomes over the next 8 weeks will be for you to manipulate information and data using health information management software, analyze the implementation of health information technology, explore how billing and clinical care systems affect healthcare operations, and then assess technology's influence on individual task performance and improvement. And I'm just going to do a quick overview of the syllabus and really the kind of main deliverables that we have over the next 8 weeks, such as in week 1, when you're going to survey the information systems landscape, and you'll do that by using a conceptual diagram to kind of understand the big picture of health information management. By the way, you'll notice here that we use a lot of terms synonymous and interchangeable with each other, and so don't want you to get confused right off the bat. The terms that I use the most are health information technology and health information systems. Together, those two terms loosely make up the idea of health information management. And then, of course, when you start drilling down on a granular level, particularly as it relates to health information technology and health information systems, you're looking at technologies such as electronic medical records, patient portals, um, and other types of clinical data repositories, if you will. And that really gets us right into week 2 when we look at clinical care systems and specifically a rubric for evaluating electronic health records. And we've been in the age of the electronic health record now for about a decade. We've got upwards of 95% implementation in major hospitals across the country. That number is slightly lower when we look at ambulatory health systems, but still it's in the respectable 90s. However, after over a decade and millions upon millions of dollars of incentives that the government has induced providers and health systems to adopt the records, we still don't have that synergy that we were looking for, that we were expecting to see. And so week 2 will give you an opportunity to look at some of the criteria that decision makers use when adopting electronic health records. And clinical systems such as electronic health records. Of course, there are other types of clinical systems such as radiology systems, picture archival systems, also known as PACSs, medication distribution systems. But in week 2, we're specifically looking at EHRs as a component of a clinical care system. In week 3, we start to look at billing systems. And so technically a billing system is an administrative system. So if we were to kind of step back and look at that concept, in from week 1, that concept map, we would look at health information systems, and it will be divided in clinical systems and administrative systems. And so the billing system is the key administrative system. However, there are other systems such as the practice management system, which providers and health systems use to schedule and manage appointments. There is also, let's see, we're talking about administrative systems here. There's the scheduling, there's the billing. Oh, the eligibility systems where you check the patient's insurance eligibility. Those are kind of all related to the administrative functions. In week 4, we will explore data in health information systems. And there's this language that is used called SQL, also known as SQL. And you don't have to be an expert at computer programming. You just really need to understand some basic SQL languages so you can go in there and do queries. I can tell you that on the back end of all of these major clinical systems, such as Epic and Cerner on the hospital side, or on the ambulatory side, eClinicalWorks, NextGen, Athena, Greenway, they all have some type of back-end reporting functions that will allow you to extract data, or at least organize data for reporting purposes. And that underlying language is SQL or SQL language. And we'll talk about that in week 4, but I don't want you to get excited or overwhelmed about that part of it. In week 5, how do we integrate healthcare information? You know, that's all about interoperability. It's all about the clinical team having the data and the information at the point of care when they need it for the health intervention or the care plan. And so we'll start to talk about that in week 5. I want you to really think about interoperability the way that you think about social media. So when you are on your smartphone and you're sending information via Snapchat, via Facebook Live, or other types of mediums, that's interoperability. Or the way that we have been sending money really for the past half decade, but the past almost half century, which is electronically. So you have your device, you have your bank, you have your wire transfer, your ACH, and you have the ability to send money within the country, or perhaps you're doing some type of remittance outside of the country. That's that's the idea about interoperability. It's really just the electronic exchange of data and information, but we're not quite there in healthcare. And many of you can relate to that because if you're working in these systems, you may be doing double entry, even triple entry with the same information in multiple systems. And so we'll start to at least a little bit talk about that in week 5. And in week 6, when we look at health information systems and healthcare operations. And then as we close out the course here in week 7, you'll have the ability to assess the technology's influence on performance. There's this entire discipline within a interdiscipline within the discipline called human computer interaction. And although the major use of computers are probably only about 30 years old, you probably go back to maybe the late 80s, and certainly in the 90s and the 2000s, we saw larger adoptions of computer technology to where we are today with everyone owning a smartphone, a tablet, and some other type of devices to manage and exchange data. However, the whole concept of human computer interaction really goes back to the 1930s. And the whole idea is that technology such as electronic health records, such as administrative systems, such as billing systems or scheduling systems, they should be designed to help professionals um, do their job better and do it in a more meaningful way compared to being a barrier or an inhibitor to the person doing their jobs. So, uh, a really good concept there is when we look at clinical workflows. So, if you look at an environment before the technology, before the implementation of adoption of an electronic health record, there were certain workflows or patterns of the way that the clinical staff conducted business. The whole idea about human computer interaction is when you put the technology in place, that technology should enhance the professional's ability to do their job. So if we look at the post implementation or the post adoption of the technology, do you have fragmented workflows? Are you doing double and triple entry now? Are you doing workarounds? Do you have data inside the technology and outside the technology? And those are the kinds of things that you'll be looking at in week 7 when we assess the technology. And then finally in week 8, implementing change within health information systems, where where you'll complete your signature assignment for the course. And of course, we have plenty of time to talk about that. But I just wanted to, again, send you a quick video to welcome you to the course. I am available for you Monday through Saturday from 7 a.m. to 7 p.m. And of course, if you need me after that, you can feel free to still text me or call me, and I'll most likely be available for you too. I am available on Sundays by appointment only, but tend to like to reserve Sundays for personal time. At any rate, I am here for you. I am here to fully support you 100%. Welcome to the course, and I look forward to sharing this academic journey with you over the next 8 weeks.